in order to confirm the diagnosis and prove that the patient has Ebola infection, there are a number of tests that can be done. Most usually the diagnosis is based on demonstration of the virus in the bloodstream through a technique called PCR testing, or polymerase chain reaction, where you're actually identifying the virus's genetic material in the blood, which is a very specific and precise diagnosis. The virus can be identified through culture, but that is time consuming and it's potentially dangerous for those doing the culture test. You can also detect antibody response to the virus, but that occurs later down the road and would not be as early or a real-time diagnostic test.
Wow, so the diagnosis itself is challenging.
It is challenging
Ebola.
in that those diagnostic tests or techniques are probably not available at most hospitals. It's something that only specialty hospitals, reference labs, the national labs like the Centers for Disease Control would be able to offer. I think now many state health departments are making those tests available as concerns develop in the United States. I'm certain that the same would be true in other countries, that there will be a wider availability of testing, but right now it's still fairly limited.
Wow. So if a person is suspected or of having, and now we have confirmed it's Ebola, how can we prevent the transmission, further transmission? Because I think that is very vital in control of any epidemic.
It's exactly correct, and in particular with this particular virus and the outbreak and epidemic that is occurring, that's critical because we have a limited number of other interventions that we can make. So right now, most of the focus is on public health measures and common sense in terms of personal hygiene. So persons who, for example, would be identified as having Ebola and admitted to a healthcare facility ideally would be placed in a private room, and that certainly is predicated upon there being the availability of a private room. I realize, particularly in the healthcare setting in Africa where there's such an overwhelming number of patients, it may not be possible to put them in a private room, but in other settings it may be possible, but they should be placed in a private room. They should be placed on isolation, that is limited access of others to that patient. Just those with an immediate need to care for the patient should have access to the room. The entry and exit of persons from that room should be carefully logged so that we know who has and has not been in there. And as part of the isolation procedure, a number of special techniques are used. Right now, the Centers for Disease Control in the United States is recommending that patients that have Ebola be managed through a combination of isolation techniques. The first called contact isolation, and what that means is that anyone entering the room and having contact with the patient would put on a gown which would be impermeable to fluids, some of these excretions and secretions we talked about. They would wear gloves, they would wear a mask, which per the CDC recommendations could be a surgical mask, not a special respirator mask. And you also have eye protection, either goggles or a face mask, and that's the current CDC recommendation for contact isolation.
And the gloves should be 2 gloves?
I think it's probably fair to say that in addition to the contact isolation, the patients were also on droplet isolation.
Yeah, I was about to ask if the mask is needed or not.
The belief that perhaps droplets of saliva or fluid when a patient may sneeze or cough could potentially transmit the virus, so the mask is necessary to prevent inhalation of that into the upper respiratory tree in contact with mucosa. And that, I think, is the current isolation technique. Now, there have been a lot of concerns about is that enough. Certainly if one sees pictures in the news, you see persons wearing suits that cover them totally head to toe, kind of like hazmat uniforms that we might have in the United States. And so there are institutions that have actually gone beyond what the CDC has recommended, and persons are actually much more covered when they enter a patient's room. And I think it's also important to emphasize that not only is wearing of the protective equipment important, but its removal and its proper removal and disposal of that equipment, which might be contaminated.
I think that's very important.
Is equally important as well. And there's a lot of emphasis now being placed upon teaching people how to put on and how to take off this equipment such that you don't contact material which might be on the the
Right.
gown, for example.
And also this mask, is it a special mask that we use in the, there are two types of mask we use in the hospital. One of them I think is called N95 mask.
N95.
95 mask. So is that N95 mask or is it a regular mask?
The current CDC recommendation is for a regular mask, but I think many institutions have gone a step beyond that and recommended N95 mask or
Which is
respirators,
even more
which is a little more protective. It's what we would use for true airborne pathogens, which might include such things as tuberculosis or measles. So many institutions have done that.
Mhm. And unfortunately, we just saw another death from Ebola in Texas. Is there a treatment available?
I mean, clearly, in managing most infections and infectious diseases, the ultimate goal is to develop effective treatments for them. I think probably the primary goal should be prevention, but certainly in those that develop disease, the goal is to find an effective therapy. Unfortunately, at this time, there is no effective therapy for Ebola that has been proven to be effective. As many persons may have heard on the news, there are a number of experimental therapies which have been developed and have been rushed into clinical use prior to extensive testing because of the urgent need at this point in time. So there are a number of companies, particularly in the United States, that are developing therapies. How well they work, how safe they are is really unknown at this time.
Yeah, that's very unfortunate that we don't have a specific treatment and we are just doing supportive care, like making sure their electrolytes are repleted and they don't have nausea, or controlling their diarrhea, and then doing serial blood counts, transfusing when needed.
Exactly. So I think at this point, the primary interventions are supportive and symptomatic and directed toward the actual problems that they're having, as you outlined. Hopefully we'll have specific therapies in the not too distant future, but exactly when is unknown.
And what can our listeners do at this time so that they don't get Ebola virus? Because now we are hearing there is a case in Spain. Now we have one patient, I think, in India. So it looks like the virus is really out there. So what can our viewers do to protect themselves from getting Ebola virus?
I think probably the cardinal thing that most persons can do, and it's within their power to enact, is attention to hand washing and personal hygiene, which is critical in breaking the chain of transmission for almost all infections. With infections that are more highly infectious and can be transmitted from other ways other than contact, you have to be a little more aware of other things. So I think clearly in this day and age, trying to be attuned to trying to avoid being around persons who are ill, and particularly with Ebola, trying to limit contact with ill persons who might be at risk for infection. One of the things which has been postulated to lead to potential spread of the infection in Africa are a number of rituals and cultural things which are done, which would include caring for the sick at home instead of helping them get to healthcare facilities, and in so doing being exposed to secretions and excretions. There are also a number of burial practices which include washing the body, which lead to exposure to fluids and secretions, which may also put people at risk. So I think at this critical point in time, one has to abandon those rituals, those time-honored techniques, and try to get those that are ill to a healthcare facility where they hopefully can be cared for properly and limit the exposure of others to those infectious secretions and excretions.
And do you think Ebola epidemic that's going on, can it be ended? This outbreak of Ebola, if not epidemic, the outbreak that has happened, is it possible that it can be terminated or ended?
Again, according to those who are much more knowledgeable than I, the experts at the World Health Organization and the CDC, their strong belief that through enacting just time-proven traditional mechanisms of public health, as we've talked about, trying to break the chain of transmission, trying to isolate patients, trying to reduce exposure of persons to risk settings will help in breaking the chain of transmission and hopefully ending this outbreak. I think given the extent of this outbreak and its rapid increase in numbers, that becomes ever more challenging with each passing day, and ultimately it may well be that control ideally may be achieved through the use of other preventive techniques, particularly such things as vaccination. As you, I'm sure, know, there is a fervent attempt to develop an effective vaccine. There are at least 2 that are already in very early phases of trials, and hopefully those will prove to be effective and preventive and can then be applied in a broad scale to control this infection, just as it's been very successful in controlling such things as smallpox and polio and measles, for example.
So while those vaccines develop, I think the best thing to do will be contain infection and not put yourself at risk by being in direct contact with a patient who has gotten Ebola.
I think that's probably a fair statement.
Well, thank you so much, Dr. James Peacock. It was an excellent information regarding the current epidemic of Ebola virus. And if our audiences want to refer to a website for authentic and accurate information on Ebola virus, where would you direct them to?
I mean, I think there are 2 really very comprehensive and very authoritative websites. The one is the World Health Organization website on Ebola. The other is the Centers for Disease Control website on Ebola. Both have wonderful information and presented in a very stepwise fashion, going from how do you get the virus to how do you recognize it, how do you treat it, and so forth. So I think very, very good sites for information.
Okay. Thank you so much, Dr. James
You're
Peacock.
quite welcome. It's been a pleasure.